All right. Welcome everyone to today's Community-Based Research Canada e-learning event. My name is Amanda Demmer. I'm the Learning Specialist and Program Coordinator for Community-Based Research Canada, and I am the moderator for today's session. Today in our Moving the Dial series, we are on our penultimate event, Moving the Dial on innovative and inclusive models for refugee health and equity, with Astrid Velasquez and Madeleine Kruth as our two presenters today. For those of you unfamiliar with CBRCanada, we are a nonprofit membership-based organization. We are situated on the Haldimand Tract in Waterloo, Ontario, the traditional territory of the Haudenosaunee, Anishinaabe, and Neutral peoples. Our mission is to advance community-based research excellence within Canada by strengthening partnerships, building capacity, mobilizing knowledge, and championing community-based research among individuals, communities, and institutions. As part of our programming, we host events like today's e-learning series, as well as bi-monthly communities of practice, where participants get a chance to really discuss the issues, intentions, and challenges of community-based research with each other. You'll find more information about our upcoming events, recordings of this and past webinars, all on our website. And at the end of the presentation today, I'll be sharing some links with you to our website and some of our different web pages. We begin each of our e-learning events with reflecting on and amplifying the goals of the Truth and Reconciliation Commission's call to action. This month, we'll be discussing innovative and inclusive models of healthcare. So I thought it was appropriate to highlight this call to action number 22. So we call upon those who can affect change within the Canadian healthcare system to recognize the value of Aboriginal healing practices and use them in the treatment of Aboriginal patients in collaboration with Aboriginal healers and elders where requested by Aboriginal patients. CBRCanada is committed to continual reflection on the interconnections between truth and reconciliation and the various topics that we approach using community-based research. We're also dedicated to engaging with and learning from diverse First Nations, Métis, and Inuit people across Canada. So getting to today's event, I'll be facilitating this panel or this presentation. We encourage folks to ask questions at any time by typing them in the chat. Our agenda today, after my opening, I'll pass things over to the presenters. There will be time for question and answer at the end. So this is when we'll address any questions that have come in through the chat. And then we'll have a brief closing before we let you go upon your day today. We do ask that during the presentation, participants keep their microphones muted to prevent any potential background noise. We do encourage you, if you'd like to, you can feel free to turn your cameras on so we can see each other, but do stay muted to prevent that background noise. If anyone would like closed captioning for the event today, you'll be able to turn this on yourself. I have it enabled on my side of things. So closed captioning, you should be able to turn on and off somewhere in your Zoom panel where you're able to control your microphone and your camera. This website or this event will be recorded today and available on our website for you to watch again later or to share with others that missed the event but you think might be interested. So without further ado, I'm honored to be introducing our presenters today. Astrid is the Executive Director of the recently opened New Canadians Health Centre. The New Canadian Health Centre is a multidisciplinary community health centre of medical and allied professionals. And it's linked to a comprehensive set of programs and services to support refugee health and well-being in Edmonton. Astrid has worked with Catholic Social Services for the past 17 years in the settlement sector, being responsible for several government assistant refugee programs. Astrid holds a bachelor's degree in education, and she's certified settlement practitioner. She's a strong advocate for refugee health. She was the previous co-chair of the Refugee Health Coalition, and she's a National Newcomer Navigation Network member. Our other presenter today is Madeleine Kruth. Madeleine is currently the Research and Education Coordinator at the New Canadians Health Centre, as well as a second-year medical student at the University of Alberta. Prior to Madeleine's current role, she's worked as the project coordinator for several major tri-agency funded research projects, and was the research facilitator for the Faculty of Health Studies at Brandon University. Her training is in global health systems, having completed undergraduate degrees in both international relations and disaster and emergency studies, as well as a master's of global health. So I will pass things over now to the two presenters. There'll be a little pause here as we switch our screen share.
Great.
So Madeleine, you're welcome to share your screen.
Thanks so much. Go, and I'll just take one more minute. Perfect. All right, is that all right for everyone? Okay, great. Thank you so much for that introduction, Amanda. We really appreciate it. And as we are jumping into our presentation, I'd like to say that Astrid and I are here to speak with everyone today, but we're part of a much larger team, both in terms of the research side of things and then the clinical and service delivery side of things. So we're really appreciative of all of our team members, a few of whom are here as well. So we'll be able to hopefully support in answering some of the questions. And I really appreciate the land acknowledgement that you provided at the beginning. So we're also going to do a land acknowledgement for our location. So we are based here in Edmonton, and both the University of Alberta and the NCHC acknowledge that we're situated on Treaty 6 territory, which is the traditional lands of both First Nation and Métis people. So we acknowledge that we're located here on the Treaty 6 territory and respect the histories, languages, and cultures of First Nations, Métis, Inuit, and all First People of Canada, whose presence continues to enrich our communities. We recognize that this is the traditional gathering place for a very diverse and longstanding group of Indigenous peoples, including Cree, Blackfoot, Métis, Nakota Sioux, Iroquois, Dene, Ojibwe, Saulteaux, and Anishinaabe, Inuit, and many others whose histories and languages continue to influence our community here today. And just the last thing that I would like to say here is that Treaty 6 is the only treaty that does incorporate what's called the medicine chest clause, and that there is a mandate within the treaty to provide medical care to Indigenous peoples here. So that's something that we think about a lot in terms of our position here at the NCHC and the ways in which that we continue to support the communities, both of newcomers and those who have been here for a very long time. So with that in mind, I'd like to just address a little bit of the context of refugee healthcare in Canada prior to talking a little bit more about what we do here at the NCHC. So globally, 26.6 million refugees were forced to leave their countries due to conflict, political unrest, human rights violations, and persecutions just in the past recent years. And Canada is committed to providing a safe asylum for vulnerable citizens globally. And we've seen a continuous influx of refugees. So just to give some ideas of those numbers, close to 20,000 government-assisted refugees and over 30,000 privately sponsored refugees were resettled just in the past year. We can imagine that those numbers will only have increased over the past within 2023 once those numbers have been acknowledged. And also these numbers don't fully encapsulate all of the refugees, as this is only representative of 2 refugee classes of multiple that we do receive here in Canada. The provision of quality, timely access to healthcare is absolutely central and essential for refugees' successful integration into Canadian society. However, the healthcare journey of refugees is complicated by many factors, including profound mental health challenges, rare diseases, unsuitable living conditions and unstable housing, and linguistic barriers. So given that Canada receives such a high number of refugees, interest groups and decision makers have identified refugee healthcare as an emerging public health priority.
Okay, I guess it's my turn. So hello, everyone. Welcome today. My name, as it was mentioned, is Astrid Velasquez, and I am the Executive Director of the New Canadians Health Center. I came to Canada 21 years ago. I am a former refugee from Colombia. And we're very proud of the work that we are doing here because the New Canadian Health Center came to happen after a decade of advocacy and a long-standing dream that many of us had in the sector to be able to properly assess the healthcare needs of refugees in Edmonton. Edmonton was the only major city in Canada without a dedicated refugee health center. So for us, it was very important to do this work. We wanted to create a very unique health center, maybe learn from other cities in Canada and being able to fulfill basically the specific needs of our city. But it took a very long time to convince different people to be able to do it. However, after 10 years, we were able to open. We did it in the middle of a pandemic. We did it in the middle of taking care of the backlog of refugees that couldn't travel. And also the crisis in Afghanistan happened, leaving us in a very tight situation to be able to have enough capacity to see all refugees that are arriving in our city. However, we had some time to do this work, and we had so far been open for a little bit longer than 2 years. We are still finalizing establishing the health center, but we have been able to see nearly to 2,000 refugees. So what we are so unique and why we are so different, basically we wanted to do a nonprofit community health center. So we wanted to do something that was from the community to the community. We wanted to take into account not only the clinical piece which is essential and very important, but we also wanted to have unique services for our patients that will allow them to learn things like, for example, how to navigate the health system, how to be more independent, how to empower them, how to make them successful in Canada. And believe me, when we talk about refugees and refugee health, even that dedicated services are needed at the beginning. Refugees, we are not a burden. We always want to give back to the society, and we want just to be able to thrive and basically do many things. As many of you know, refugees do not have a status in the countries where they are living at the moment. They actually become Canadian citizens. That is the first time when they actually can say that they belong somewhere and they can call this their home. So we are growing very fast, and we are very excited about it. And one of the reasons why we are so, I think that we have been so successful, and we are able to look into the future is because we have this amazing team, the research and evaluation, and they have been helping us to develop since we opened with the tools that we are going to be needing to continue advocating and requesting funding from the different sources. One of the biggest limitations that we had when we were trying to make a case to open was that there was not enough research in Edmonton to be able to support the need of having a dedicated and unique health center. So I don't want to read it, but the slide has been up there for a while. What we are trying to do is we are trying to be a kind of one-stop shop where we are able to integrate the different resources for our patients. We are still what we call a transitional clinic, meaning that we are able to keep our patients for up to 2 years. And after that, and equally important, is to create awareness and education in the city, where other clinics and other family doctors welcome refugees and are able to take care of them in a similar way that we do. It has been really nice to have the health center, because when we are going out there and we are encouraging people to do this, they know that they can rely on us to be able to facilitate all of that. So at the moment, we are located in the reception house of Catholic Social Services, one of our stronger partners. And we are an independent organization, meaning that our decisions can be based on what the community needs and what the community is guiding us. We do have family doctors, we do have specialists, but we also have other allied professionals like psychologists, behavioral health consultants. We do have physiotherapy. We do have speech therapists. And basically, again, what we are trying to do is to continue with that trust relationship that we have been able to implement from the beginning. And we are able to provide better care to our patients. Can I have the next slide, please, Madeleine? So the road to open the New Canadians Health Center, it was very hard. And many times I thought that we were just going to give up and we were going to basically just continue the little resources that we had. But basically we did have a very small clinic. It was a screening clinic in the basement of the reception house at Catholic Social Services. But that was closed, and then we were forced to form the Refugee Health Coalition, where we had family physicians, we have specialists, we have academics, we had people from the settlement sector. And later on, we were able to involve the government, we were able to involve immigration and others in order to be able to build what I call, we need all of this to be able to sustain something as unique as it is the Refugee Health Center. We always count with having the life experience circle. Our natural leaders from the different communities in Edmonton, and as I was explaining before, they guide us through the whole process. At the same time that we were establishing and opening the health center is when we developed the principles, and as it says in the slide, basically we are driven by them. And I will let Madeleine talk about them.
I seem to have occasionally some trouble advancing the slides. There we go. All right. So as Astrid was mentioning, the NCHC is really unique in that it uses a principles-based model and is the only or the first principles-based model clinic that provides and responds to refugee healthcare here in Edmonton. So these principles and guidelines allow the NCHC to make effective decisions and build meaningful partnerships that attend to every client's need with both integrity and purpose. We make an active effort to acknowledge that the social determinants of health are such significant and strong influences on immigrant and refugee health. So addressing these challenges by fostering an equitable, just and inclusive environment for every client is essential in really responding to the intention and the purpose of the NCHC. You can see a visualization of the principles here, but essentially all 5 of these principles, which are acting collaboratively, community ownership, social model of health, that we're welcoming and inclusive, and that we've created a supportive learning community, are all intended and were defined by we're all defined by the Refugee Health Coalition and the founders of the NCHC with the intention of promoting a social justice promotion of social justice, equity, and inclusion. So that kind of leads into both everything that we do at the center, as well as everything that is related to the research that is happening at the center. And I'll pass it back to Astrid.
So a little bit of what I was saying before, we do count with many partners, basically because they do provide different services. One of the biggest fears that I had when I was opening the health center was not to have enough mental health resources for our patients, mental health being #1 among refugees. I was really scared of that. So we partner really closely with different organizations. And we do have, as I was saying before, our own psychologist on site who comes once a week. We do have our own behavioral health consultant who also comes once a week. And different organizations that have trained staff for cross-cultural counseling. And very proudly, I can say that We do not have any people in our waiting list. All our patients' mental health needs are being taken care in certain ways. So it is very good to do it. So how do we do this? We all work very closely together. We do have our different teams as explained here. And basically what we do is we really partner to be able to successfully operate the New Canadians Health Center. One of the things that I have seen in my experience in the settlement sector, as well as with the clinical piece, is that in many places, you cannot rely on only one organization or only one funder, just because things can change at any moment. And I have seen it in the last couple of months where doing this work is very challenging, because it's always that uncertainty about funding, or depending where we are at, then people will believe in us and will provide it. So what we strongly believe in the relationships that we have created to be able to succeed. One of the things that also has given us a lot of experience and to learn from it, it has been having the different communities support the new arrivals. So in my career, I have had the privilege of settling the different groups of refugees. So first the Colombians, then people from Bhutan and Nepal, then people from Myanmar, then people from Syria, and more recently Afghan. And in between, we had always welcomed people from Somalia, Democratic Republic of Congo, Eritrea, different places. And it's very beautiful to see how the different communities are growing, and they even go and support new arrivals from the beginning. They go to the airport, they welcome them. You know that they are being supported by taking them to different appointments and just basically teaching them how to navigate the different systems. So I believe that all of this is very essential to be able to do this work. We also do have other very strong partners, like, for example, in Alberta, we have the PCNs, which are the primary care networks, and we partner very closely with the Edmonton North PCN. And basically, they provide to us a staff that basically is being paid by them, but they come and they do some work here at the health center. So that allow us to use the funding in different ways depending on the needs. Because these things change very quickly around here. Like sometimes what is working for us this week is not working the next week. So having that sort of flexibility is very important. For our board, what we are hoping to see is a board that is being very diverse, having people from the circle of life experience, having people from the different communities, and basically for maybe board members who are more experienced, they can pass on those skills to newcomers. And even though that we are brand new, we are already thinking that it will be wonderful to have patients who are not our patients anymore to also contribute and being part of this. So not only we have the board of directors, but we have different committees, and this is where different people from different places come and they are part of it. Like, for example, the strategic committee. So basically what we are trying to do is also trying to see where the future is taking us. What do we need to do to have this a sustainable model? How we can make it reliable, how we can create different ways of looking into the future without having something about the nonprofit organizations is that we are always in this very tight spot where funding is very important. And I already mentioned about the importance of the research and evaluation, because this is what is allowing us to apply for new funding, apply for new grants, and do different things like this. So it's very exciting to see that happening in Edmonton now. So what do? We do have an intake upon arrival in Edmonton. So we have 3 points of entry in Canada, or we used to: Calgary, Vancouver, and Toronto. And now Edmonton has also become what they call a hub. So basically, we are welcoming charter flights arriving directly from another country into the city. And this means that we are welcoming thousands of refugees instead of just welcoming a few hundred. But the statistics say that by 2015, 50% of the population are going to be immigrants and newcomers. So what we are doing when they arrive is that we do a proper intake. Basically, what we want to do is we want to screen for things that maybe doesn't happen in a regular family doctor's office, depending on where they are coming from. We may need to check for certain things. And then we provide the primary clinical services. So basically, we are the family doctors for up to 2 years. We have our 3 pediatricians at the center. We do have the psychological support. We have infection diseases, so we can take care of things like, for example, latent TB and other communicable diseases. And then we do provide health navigation. We need to also have that appointment with the physicians, but also we need to ensure that they know how to get to the lab, how to get for imaging, how to go to the specialist appointments, how to basically learn how to do this. So we do have 2 health navigators in our center, and they provide these services for our clients. And the other thing that the health navigators, they do is they create a very strong connection with family doctors in the community. So basically, we convince them to please take our patients because we promise them that we are going to be taking really good care of them for 2 years. And when they transition, they are ready to be able to be more of a regular panel of patients. And so very strong work that we need to do. Unfortunately, we do not have enough family doctors in the province. So we have to be very creative about this piece. And again, having those relationships built for decades had really helped us to do this as well, because that's another piece of being successful. We don't want to take really good care of people for 2 years, and then what happens later? You don't want them to fall into the cracks again, or you don't want them not to continue with the treatment. So very important. And then we do have very strong collaborations with the different settlement organizations to help us support. So sometimes we call them community support workers. Basically, what they do is they teach clients how to take the bus, or they teach clients how to learn addresses in Edmonton, or how to or life skills. So we rely heavily on the organizations that provide settlement services. So in this case, and at the moment, Catholic Social Services is the organization that has the contract with the federal government to settle the GARs, the government assisted refugees in Edmonton. So they can provide services up to 2 years. So we do work very closely in collaborations. One of the dreams of the New Canadians Health Center is to see all immigration categories, not only the government assisted refugees, but private sponsored refugees, refugee claimants. And one of my personal dreams is to see undocumented. So at that moment, and not already, but we keep partnering with the other agencies in the city that also settled these other refugees. So I'm going to introduce you to a friend of mine. His name is Lam. Lam was in a refugee camp in South Sudan for many, many years. He has a medical condition that really limits him in his mobility, but I have never met such an incredible like human being as he is, so positive, you know, in the worst moments when you are like down or anything, you just needed to talk to him for a few minutes and then he will completely change your mind. He arrived in Canada about 2 years ago in Edmonton. He lived at the reception house because they couldn't find the right accommodation for him. So he had to stay longer with them. But it was wonderful because we had the pleasure of actually having him close to the health center. And he will come, he will even offer to volunteer. He helped me translate some videos and do some stuff like that. So you can even see in the picture how much his face has changed and how full of hope he is. And after he got his power wheelchair, he was so happy about it because he could go anywhere. He started volunteering and he was one of the persons at the airport welcoming the charter flights of refugees from Afghanistan. Lam speaks 6 languages, speaks English very well, and now he is attending college and he is taking English as a second language just to be able to get all his education in order because he is dreaming of going to university. So this is just one of the examples that I can tell you how refugees are so resilient and how they want to give back, sorry. Lam already is also a volunteer for Catholic Social Services, and he never hesitates to help us with anything that we need. He is a role model for sure and an example for many of us.
So we've told and talked a lot about the NCHC and the purpose of the organization, its foundational principles, and a bit about the clients that use the services. And like Astrid was saying, a big part of that is demonstrating the impacts and doing a good and strong evaluation and co-research with the service users and with the entire community. So with that in mind, and with also kind of in mind of one of the purposes of us being here today is to share a little bit about both building the research program as well as the evaluation that we're conducting at the NCHC. So underneath the Community University Partnership, which is at the School of Public Health at the University of Alberta, we are specifically underneath the Evaluation Capacity Network, which is kind of another smaller kind of group and working group underneath that partnership. And the purpose of building our research program is really the collection, co-creation, and translation of knowledge that is generated at the NCHC. So this partnership has resulted in a really strong culture of research and evaluation. And one component, as Astrid was talking already or mentioned already, is the Research and Evaluation Committee. So that committee contributes to the active research projects and is implementing the broader principles-based evaluation at the center. Because it's so important to ensure that the research activities are informed by the clients and by the community and the staff and everyone who are impacted by the services. The committee is comprised of both community members, academic staff, medical, graduate, and undergraduate students from various health sciences and social sciences disciplines at the University of Alberta. And some of the key functions of the committee, but also of the research program in general, are collaboration with the NCHC to establish an evaluation and implementation framework, which aligns with the values. And I'll talk a little bit more about that in just a minute. We're also working on developing a data access and research protocol for prospective researchers to ensure that there is well-governed, but also transparent access to data at the center. We're working on supporting and mentoring students across many different types of disciplines by involving them in NCHC operations as well as academic projects. And then interfacing with the board of directors, the circle of lived experience, and really all stakeholders who are involved to ensure that we accommodate and learn more about the evolving community needs. So one of the major things that we are currently working on is a principles-based evaluation. The research and evaluation team has conducted a study that documented the established need for the implementation of the NCHC, and a few of the lead researchers on that project are also here in the audience today, so can potentially answer some additional questions later on. So the purpose of the research was to learn more about the strengths and areas for improvement of the center's development. And the previous kind of research that was done really looked at the significant findings of the creation of the center. So now that we're looking at the center at the moment, what we would like to do is principles-based evaluation that engages service users, staff, and key informants using a whole wide variety of different methods to look at how the principles-based model is implemented and how it is impacting the way in which the community engages with access to refugee health and refugee health in the long term in terms of impacts on settlement experience. So this is a really rapid and broad overview, but I recognize that we're running short on time. So I might move on to just our last kind of concluding thoughts, and hopefully we can have a little bit more conversation about the evaluation and other research as we move into the discussion period. So looking ahead, I will just talk briefly about looking ahead for the research side of things, and I'll pass it back to Astrid to wrap things up. The establishment of the research program at the NCHC is really still in its nascency, and we still have so much to look forward to. So I think we're all very, very excited about the work that's happening here. A current focus is the optimization of the electronic medical records system and identifying areas for improvement in that space. So hoping to increase and improve some of the efficiency of those systems. We're also conducting the large-scale evaluation of the principles-based models. So the space that we're at the moment is the ongoing data collection, analysis, and interpretation of all of that information. And we're especially paying attention to the ease of long-term integration into the Canadian healthcare system. And ultimately, our goal from the research side of things is to foster really a conscientious research environment that contributes to the health and well-being, both of the service users and clients at the NCHC, and more broadly of refugees arriving in Canada, but also of the huge communities that surround those services. And I'll just pass it back to Astrid for the very last to wrap things up.
I couldn't find my mute. You will think, right? So basically, one of the two biggest things that we are concentrating at the moment, being very honest, is we are still finalizing the establishment of the health center, because everything that I explained before that happened when we opened and what is currently happening in the world, basically. Two priorities will be to finalizing the charitable status, so we are able to start our fundraising campaign. And the other one is that we are part of a very huge affordable housing project together with the Multicultural Health Brokers, which is another settlement organization in Edmonton. What we want to do is we want to build affordable housing for newcomers and refugees. And we also want to have the home of the New Canadians Health Center and the home of the Multicultural Health Brokers. So that is even something that is going to take a few years to do. And then in the meantime, we also want to do a few satellite clinics in the city. So we want to keep the one that we have at the Catholic Social Services, but we also want to have one in two other organizations that we have been talking to. So those two big ones, just thinking about short-term and long-term plans that we have in mind. Thank you.
All right. Thank you both so much, Madeleine and Astrid, for sharing all of the information you shared with us, both about the health center itself and about the research and evaluation portions of this health center. This is the time for anyone here to ask questions. So if anyone has questions or things they'd like to ask of Madeleine or Astrid, please feel free to type your questions here in the chat. We'll get to as many as we can in the next 20 minutes. I'll start off just, Madeleine, you were starting to touch on kind of some of the evaluation and the research that's been done of this center. And one of the things that strikes me is the center itself has this very strong grounding in these values and these principles. So how is the research being done on the center maintaining that same grounding in values and principles?
Yeah, I really appreciate you asking the question. And I think that's something that's quite unique and really interesting about the evaluative approach that we are using. So there's multiple ways in which we're trying to address that. And I'm going to also invite, there are some other members of the research team who actually have been around with this project longer than I have. So I'd also really welcome them to jump in and add their perspectives too. But to kind of initiate that, so we're using principles kind of framework, a principled framework for the evaluation, in which really we're basing things off of digging into how this principled framework does impact and does change the way in which people are kind of interacting with the center and accessing services, both from perspectives of clients, but also from perspectives of staff and others who kind of surround the community in terms of allied healthcare practitioners, anyone else who does receive referrals, for example, board of directors, anyone who's really interested and has a stake in the NCHC. I know that's kind of a nebulous and not very concrete response for that perspective, for that portion, but part of like how we're enacting that in practice is constant engagement and involvement of all of those stakeholders in both the design of our tools, in the direction of how we do collect the research. And we will be, as we continue to do collection and then evaluation, analysis, and dissemination of our findings, we are going to be regularly engaging those communities. So one of the most important communities that we work with really closely is the Circle of Lived Experience. And we have a few folks who are from that kind of group who are helping us ensure that the tools that we're using are appropriate and well designed and like kind of engaging the communities that we're trying to access in a good way. A huge part of that is, how do we write our questions? How do we access and build relationships with community members prior to kind of digging into those more challenging questions?
Thank you for sharing. And there's a lot of other questions going in, so I feel like I have a lot of follow-up questions there, things we could dig into further, but I'll take a look at some of the questions that have come in. And I see some of your colleagues have already started addressing some. So there was a question that came in from a master's student in Toronto one day wondering about joining in supporting your project. And I see Rebecca was able to respond to that. Thank you, Rebecca, with your address, Madeleine, to email out to. Next question I see here, what are some barriers you're finding to housing refugees from your experience?
So again, because Edmonton has grown so much and we're welcoming so many people, and basically inflation and everything is changing things around here. Some of the barriers are finding landlords who are going to be renting to our clients because they are just landed immigrants. They don't have any credit history or anything like that. So basically, it is very complicated because we have to develop those relationships and continue working with them, but they are running out of places for the clients. Something else is that agencies like, for example, Capital Regional Housing, who provides affordable housing, is at full capacity. So many of those, we continue the advocating process to be able to get additional funding through immigration, the IRCC, to be able to do this.
That's great. Anything to add, Madeleine? Is that comprehensive?
I think so. It's, I mean, Astrid has had so many experiences and is so deeply embedded within all of the efforts to try to increase the affordability of housing. And, it is something that I think all of us are really recognizing the pressure and the push just on everyone, all of us as just people trying to exist in the world right now. And that pressure is just exponentially increased for the clients who do use the services at the NCHC. So yeah, hopefully folks can kind of recognize that and acknowledge the additional challenges there, but we're working really hard to try to do something about it.
Great. Okay. Another question here, and I see one of your colleagues, Pauline, has answered it in the chat, but to give both of you a chance to expand, the question came in about if you offer any nutrition counseling to your clients, and do you feel there's a need for that?
We do provide, is part of our our different services, as you know, is not only teaching them how to, or what is it that they need to eat or have, but also how can they afford that, right? Because you can have all these recommendations and everything, but yeah, I cannot buy this type of food. So we need to be very creative. And when you are doing, for example, an iron teaching, you know, what food to eat, what not to eat, you also need to think about, okay, but I'm also going to refer you to one of our organization's partners who are going to be able to provide you with certain foods that will help you, you know, thrive and be able to address this. So it's very important. We are very lucky that we do have LPNs in our health center, and sometimes they have dedicated time to even talk to patients when they are in the appointments with the physicians, or even to call them back and just have like a type of an education session with them, or even to do follow-up calls, because as you can imagine, when you're a refugee and you're a new arrival, you are thinking about how to afford your house, how to be able to give some food to your children. You're not going to be thinking about, oh, my high blood pressure is off the roof and I have to take my medication or anything like that. But what we are trying to teach them is like, no, you need to take care of certain things so you actually are going to be able to take care of your family. So it's an overall services that we have to think about the different pieces that are in place, are needed.
A very holistic way of thinking about it, and very kind of client-centered as well, it sounds like, which Pauline had touched on in the response in the chat as well, that any services the center thinks the client needs is provided to them. So that's excellent to hear.
Also, the primary care networks, the PCNs, they have all these amazing services that we can refer to. And so we also do refer to them to kind of have the additional support, but we also do partner with the settlement organizations. They do provide information sessions for the clients after arrival. So there is a whole day where the health information session happens. So we contribute, we give our feedback. Sometimes we go and participate at the information sessions, and we touch bases on things like, for example, food, pediatrics, different things like that, that, you know, maybe you will take for granted in a regular setting, but in here it is important to mention that dental health, and immunizations, prenatal care, all of those.
Excellent.
I might just add one thing just to what Astrid was saying, and that like it is so important to like have this comprehensive service package. And I think nutrition specifically is it's quite complex, and more complex than like might initially come to mind when you're thinking about access to nutrition counseling. And in addition to the nutrition counseling comes all of the service navigation, and how do you not only learn how to, you know, have appropriate nutrition, but also learning how to, for example, go to a grocery store might be something that is completely novel to some people that are coming in. So that is also something that is included in like the understanding of how do we respond to and support the needs of the clients here. And we're trying to respond to that through some things like some new programming. We have students in service and volunteer programming, and additional kind of core services that are provided to really help people do get that essential understanding of how the systems work here. And then beyond that, there's the affordability aspect. It ties into the security of housing. There's all of these complex things. So like Astrid was really saying, is the interconnectedness of all of the services that are provided.
Very holistic approach. And I imagine all those complexities make it more difficult to evaluate in some ways. We'll try to answer a couple more questions before we go here. There was a question that came in about whether the NCHC or your partners have an approach to undocumented residents. And I see Pauline has already responded to this to say the center currently attends to only government-assisted refugees, but the target is to extend this to all refugees, including undocumented, in the future. Would either of you like to add to that response at all?
I will. So because we have so many barriers in Edmonton, and we couldn't even have a dedicated refugee health center for so long. What we did is we got really creative. So at the same time that I was running the very small New Canadians clinic, that it was only a screening clinic for government assistant refugees, we were partnering with different physicians in the city. And basically what we did is we created another small clinic. It was in a basement as well. And basically we got a bunch of donated equipment donated. And we went and talked to the lab, and we talked to Imogen, and we were asking them, can you please give some donations and basically help us with this? And they say yes. And also we did partner, there is an association here in Edmonton called Migrante. So Marco, the ED, is a very good colleague of mine. And basically we were partnering with him to be able to protect his clients and being able to offer services when they knew that nothing was going to happen to them. In many cases advocating at the hospitals so they wouldn't charge them thousands and thousands of dollars. Some people doing some volunteer work and work for free. So it's everything that we could do. Basically, is something that happens in Edmonton is that a lot of people work really closely together, and whatever I don't have, you have, we share. So that's exactly what we did. This physician continues to see. We had to close the clinic that he was running, but he continued to see people in his private practice, and he continued to have the lab and the other supports. However, it is something that is one of our priorities. I believe that the most vulnerable of all refugees are our refugee claimants and our undocumented, because they really do not have the services that the other two groups have. Government assistant refugees as well, but I feel like they have other resources in place. Canada has made the commitment to welcome the most vulnerable refugees in the world. So I know that the population for government assistant refugees has lots of needs, but as I was saying before, there are resources. As soon as they land in Canada, they are permanent residents. They can apply for health card in the province where they arrive. So it is a little bit different. I'm pretty sure that once we have charitable status and we are able to function in a different capacity, then that's our plan, to be able to see everyone, and we are not attached to a certain funding, but we have that flexibility. So one of the things that I advocated the most was that we were not going to be attached to a specific organization or to a government body. We wanted to be independent, so our health center can be serving the community instead of having to serve, and all due respect to everyone, but not having to, just don't go by all the rules and all the funding requirements, but we will have certain flexibility to be able to do this. So it is a dream, but we dream about this health center, and we were able to make it happen. So I don't see why not. We can continue.
That's excellent, Astrid. Thank you. And I think a lot of what you spoke to there answered this other question that came in about strategies you have to make that happen in the future, serving the undocumented migrants. So to close off, and maybe this is a question for you, Madeleine, and if this can be answered in 1 or 2 minutes or as kind of succinctly as you can, but I think a really great question here regarding evaluation. So have you experienced any difficulties showing the efficacy of important but maybe less visible or quantifiable health supports in the evaluation of this program?
Yeah, it's a great question. And I think I'll premise that by saying that the evaluation is still quite in its early days. We've had a long road kind of getting to the point where we have started to implement the actual collection of the data for the evaluation, but it's been really since the NCHC opened its doors that we've been thinking about this evaluation and how best do we strategize and ensure not only is it culturally responsive and we're working in as closely as we can with the community, but also how do we demonstrate those really challenging, less tangible outcomes. So one of the ways that we're doing that is kind of more, we have two streams of data collection for the evaluation, one of which is more document and data facing. So that is using the EMR or the electronic medical records, any document like a document analysis. We're going to be kind of doing like a systems analysis and all of that kind of stuff. And then the second stream is really more participant focused. And that stream is engaging in direct conversation through focus group interviews, through home interviews, through client surveys, all of those kinds of things to speak with not only the service users, but also the staff. We have key informants who are anyone who works quite closely with this community. As well as, just as many clients as possible. And we're hoping through that method that we're going to be able to uncover some more of the intricacies of those types of really essential services that aren't traditionally captured in the outcomes-based models that we might see in other centers. So that's what our hope is. It will be determined, and I'm sure that we'll have to make some adjustments as we go, as in any kind of major project like this.
Yeah. Are there any links or web pages or anything I can share with folks for where they can go to kind of get updates as the evaluation evolves? Perfect.
Absolutely.
Thank you.
So I just popped the link for the NCHC website in here. It's the brand new website. There is still some kind of updates that will happen with this website as we go. So it's not completely finalized, but you can get a lot of information here and kind of an overview. One of the major things that we'll be including is the research page that is still to come on this website. So there'll be like a specific page that will keep everyone updated on the research activities, our outcomes. We'll be publishing all of our findings, all of that kind of thing will be available here and free for anyone to be able to access.
Excellent. Well, we're coming to the end of our time together today, so I'm going to wrap us up. But I see, Madeleine, you provided your contact information in the chat for folks. And I think Rebecca had provided contact information for herself and for you as well. I think there were 3 or 4 different people mentioning they were very interested in getting involved in this project. That's very, very cool to see. It's great when we at CBRCanada can facilitate some of those connections. So I will wrap us up just by saying that thank you so much for everyone for being here today. Thank you, of course, to Madeleine and Astrid, our 2 presenters here. If anyone would like to watch this webinar again in the future or share it with others who may not have been here today, you can do all of that on our website under the resource section, webinars and discussions. You'll also find the slide deck from today in there as well. Also on our website, you can sign up for our newsletter. This is where you'll find information about upcoming events, such as our e-learning series, our community of practice, other things that we've got going on. So stay connected with us. And we also want to mention our next event in this series coming up in 2 weeks. It's our final event of the Moving the Dial series on moving the dial on support for families affected by mental illness. So signing up to our newsletter is how you can get the updates and the registration link and everything for that event. I've put the link to sign up for our newsletter in the chat so folks can follow that link. And lastly, of course, we welcome your feedback in this session. We'd love to hear from you how you think these events are going, if there's anything else you'd like to see in these events, if there's any future topics you'd like to see. So feel free to follow the link I've put in the chat or scan this QR code to give us your feedback. Thank you again so much, everyone, for being here with us today, and to Astrid and Madeleine for the wonderful presentation. And as well, I will thank your colleagues in the chat, Pauline and Rebecca, who I know we're helping manage some questions as well. So thank you, and wishing everyone a wonderful rest of your day.
Thanks so much for the opportunity. We're really grateful to be able to share this all with everyone.
Yeah, thank you everyone for the encouraging words. Have a great day.
Cheers.
Good job, Madeleine and Astrid.
Thanks, Rebecca. See you soon.